Coming up next on Arizona Horizon, we'll hear from the head of the Department of Economic Security about plans to streamline Arizona's safety net and help reduce dependency. And we'll get an update on efforts to keep the valley safe from terrorist attacks. Those stories next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.
Good evening and welcome to Arizona Horizon. I'm Ted Simon. State lawmakers will be hit with an automatic cut in pay this week as the legislative session drags on past the 120-day mark. Lawmakers from Maricopa County get a $35 a day per diem for expenses. That will now be cut to $10 a day. Lawmakers from other counties will see their expense pay fall from $60 a day down to $20 starting tomorrow. Well, last week, Department of Economic Security Director Clarence Carter announced a pilot program to streamline the delivery of state welfare services and help get people off assistance. Joining me now to talk about his plans to revamp DES is Director Clarence Carter. Good to see you again. Thanks for joining us.
Ted, it's my pleasure to be here with you this evening.
Reinvent Arizona's safety net system. What are we talking about here?
Ted, what we are talking about is currently the safety net is an aggregation of single-purpose programs. Each program addresses a singular aspect of the human condition, whether or not it's nutrition with a food stamp program or health care or housing or on and on and on. Okay, those programs are all designed, as I said, to address one aspect of the human condition. They were not designed to work in conjunction. And so it becomes difficult for an individual, and many of those that the safety net serves needs multiples of those remedies. It becomes difficult to work those together to help increase that person's functioning and reduce their dependency. So our initiative here is about knitting together those programs and then having the intention of not just delivering a benefit, good, or service, but actually in the context of delivering the benefit, good, or service, help to grow the functioning of that person and ultimately reduce their dependency.
You're talking 40-some-odd agencies, I believe, at play here, and it sounds like you're saying that most, if not all, are working in silos. How do you, I mean, that's a lot of agency, that's a lot of interaction. Is this an overview, a 30,000-foot level kind of an idea? What's going on here?
Well, of course, it is driven by a 30,000-foot vision, but our work is to try to make this all practical, okay? And this is not something that we can only do from the state level, because most of these safety net programs are authorized by the federal government. And so we have both a state and a federal component of this work. Next week we will go to Washington and lay out the case for this reinvention with the federal government.
I want to talk about those federal waivers in a second here, but first of all, back to the idea of working together, people-centric models, how you've described it.
That's exactly right. Currently, the way that our system operates is we focus on the objective of the program. Okay? We meet the mandate of whatever the program is. Our argument is that we ought to focus on the need of the individual and, quite frankly, bring the mandates of the program through the need of the individual. And it ought to ultimately be our intention to help that person remediate this circumstance in their life so that the safety net is only a mile marker in a life's journey, not ultimately a destination.
Is that remediation not going on now?
No, it's not, because again, the intention of the system, what we are currently held accountable for, is the delivery of the benefit, good, or service. If I get you your SNAP or your food stamp benefit, then I have achieved success. There is no further look back what we do then to help you not need that benefit. So we are held accountable for the efficient and effective delivery of benefits, goods, and services, not whether or not people get better for the delivery of those services.
But some would question whether or not Department of Economic Security should be involved in anything other than delivering these services. Is that not job one?
It is job one, but we believe that there ought to be a complementary job with job one. It shouldn't be job only. And right now it's job only, not just job one.
So how do you do that? If I'm someone who gets food stamps or other forms of assistance, I come to DES, I need for that assistance to be delivered, and then what?
So then the first thing we do is, of course, we would determine whether or not you are eligible to receive a benefit, good, or service. But at the same time, this approach has us doing a 360-degree environmental scan of you and your family to determine why is it that you are in this circumstance. So while we deliver the benefit, good, or service, we also have a plan, a person-centered plan based on your circumstances to grow your capacity to ultimately eliminate the need for you to have this benefit, good, or service.
Is this the kind of thing where if I had been injured, if I had some health problems, if I had not worked in 2 or 3 years, you would look at that and you would say?
I would look at those and say all of those elements are part of your environmental scan. And we have to take into account all of those things to help you figure out how to grow beyond this moment in your life.
I've heard some criticism of this, saying it's a good idea, but it's really not new. That this has been the idea has always been to get folks off of assistance as best you can, but the process of delivery is so all-encompassing, it's difficult to go to the job 1A,
right,
as opposed to making sure job 1 is done, which should help with remediation.
Right. And Ted, we don't believe that our approach is Orwellian, okay? This notion of growing capacity is not a new idea. It is simply something that the safety net is not held accountable for doing. And so we believe that all we need to do is to learn from and apply an awful lot of other principles and processes that exist with the intention of growing people beyond the safety net.
Is there accountability here? Are there metrics involved?
And part of it is developing metrics. Okay, we need to develop a set of metrics by which we will measure the growth of our consumers. And so we have Arizona State University is one of our partners. They are sort of our academic laboratory around this. And so we will be developing those metrics and then measuring our success against those metrics for how we're growing the capacity of people and reducing their dependency.
When you announced this program, one of the quotes I thought was interesting is that you said, "We pay for things that are, quite frankly, stupid." Explain.
Okay. So let me use one particular example. Okay. I will take the federal Supplemental Nutrition Assistance Program, SNAP program. Okay. We pay in the SNAP program for states to increase the number of people who are on the rolls. Okay? Now there's a rationale for that. The rationale is that we want to make sure that everybody who needs the life-sustaining support around nutrition, that they're able to get that. But we actually pay to increase the SNAP rolls, while we don't commensurately pay to do anything to help people grow beyond that. Okay, and I could go through our contracting models and show you any number of things where we get what we pay for, but we are not asking for helping that individual to get better. We're just asking for the administration of that particular benefit, good, or service.
With that in mind, how difficult to shift the culture here?
This is a Herculean undertaking. I would tell you that in 1980, President Reagan said that the welfare system, it was debilitating to individual, to heart, soul, mind. It was bad economics. Okay, that launched years worth of state demonstrations that ended up 16 years later in the 1996 Welfare Reform Initiative. So that was one federal program that literally took 16 years to ultimately reform. We don't believe that what we are engaged in here is something that's going to happen to be done tomorrow afternoon. We believe that we are calling Arizona to the work, and we will create the demonstration laboratory that ultimately will result in.
Talk about demonstration laboratory there, this project. How many people will be involved? How long will it take? What are you looking for?
Right. There will be, in our demonstration, there will be 1,000 in our control group, 1,000 in our treatment group. And what we will do is we will use these metrics that we develop and look at, are we able to move the needle for the individuals that we serve as opposed to the 1,000 that are in the control group.
It's still, I still see, though, a person out there whose needle can't be moved.
Right.
And I just wonder, does the whole system become a failure if people aren't moving past dependency? What do you do for those who either don't, can't, or won't move past that?
Well, first of all, okay, we believe that we can increase everyone's functioning. Can we move everyone off the rolls? No, we cannot. Mm-hmm. Okay, there are individuals who are always going to need some degree of public support. But the idea is that we should be intentional about increasing the functioning of all that we can, so that we can reduce their dependency. This is not. We don't see this as a panacea. We simply see this as something which is vital to be added to the safety net. The Arizona safety net should be a trampoline, not a hammock.
Okay, so with that in mind, what kind of impact on your budget is all this going to have?
Ted, in the short term, we don't see this having a budgetary impact at all. Okay, I'm not going to sit here and tell you that we have all the money that we need, but I'm going to say the same thing to you that I've said when I've been with you about our child welfare system. I was not going to ask for more until I could make an evidence-based ask. That took a little while to do, but ultimately that wound up in the governor's ask for significant CPS resources. Similarly here, we're going to demonstrate this model within our existing budgetary constraints, and then we will come back at some other time if we believe we need more resources.
But there is a possibility of the target moving here if federal waivers are not. That does become kind of a variable here, doesn't it?
That's exactly correct. As I said, we are going to go to the federal government. There are waivers and workarounds that this demonstration needs from existing federal regulation and policy. So we're going to go to D.C., put together a federal policy team to assist us with those waivers.
Last question, very quickly.
Sure.
You mentioned that changing the culture was a Herculean task.
That's right.
You having to flex some muscles here a little bit?
Just a little bit, just a little bit. But you know what, Ted? It's muscles that are being flexed in terms of something that has to be done for socially and economically challenged Arizonans. So it's not. So it's not about me flexing my muscles. It's about Arizona flexing its muscles on behalf of those in need.
It's good to have you here. Thanks for joining us.
Ted, it's my pleasure. Good to be here with you this afternoon.
Get the inside scoop on what's happening at Arizona PBS. Become an 8 Insider. You'll receive weekly updates on the most anticipated upcoming programs and events. Get the 8 Insider delivered to your email inbox. Visit azpbs.org to sign up today.
The recent bombings in Boston were a stark reminder that the threat of terrorist activity on U.S. soil is still very much alive. Efforts to keep the Phoenix area safe from attacks continue on a variety of levels, though there is concern over recent drops in federal Homeland Security funds. For more on this, we're joined by Mesa City Councilman and firefighter Scott Summers. Also joining us is Scott Krushak, the Emergency Management Coordinator for the City of Phoenix. Good to have you both here. You brought a lot of stuff along with you, so hoping to get to everything here. But let's start with an overview, the status of Homeland Security in the Phoenix area.
Well, Homeland Security dollars have shrunk about 60% to our region over the last 2 years. So that's something to be concerned about. But we're utilizing those dollars to build really a regional capability, regional capacity to respond to incidents of national significance like the bombing attack you saw in Boston.
Is that regional approach different than what we've seen in years past?
Well, the regional approach is something that the federal government has really been keen on through the National Preparedness Goal. We've seen far more regionalization here in the Valley than you've had nationally. We really are one of the best at taking a regional approach through fire, police, and other in our healthcare system.
Has Homeland Security, in your mind, overall, we can talk about the funding here in a second, strengthened, weakened, changed? What have you seen?
It's changed over the years. It's really evolved. We came out of 9/11 with really a not good understanding of terrorism and how things should be, and we had very traditional systems, poor information sharing. Our response systems worked independently in silos. The regionalization, the whole community, whole response, all hazards approach didn't really exist. And we're in a different world now. Things are way different than they were pre-9/11. So I have to say, from my perspective, we're better.
So,
that was particularly pointed for the relationship between local governments, local police agencies, federal and state agencies. These grants have really helped train local officers, and it's helped fund information sharing centers and fusion centers, which have been seen as a best practice in the industry.
So with that in mind, who's in charge? State, county, city, feds? Who calls the shots here?
Well, I guess it depends on who you ask. But the reality is everything starts at the local level. So from us in the city of Phoenix, if we have an event in our city, we are in charge. We do not relinquish that. And you've seen that the recent event in Boston. Boston's in charge of that. FBI and supporting agencies come in. 9/11, who was in charge? Very clearly, the mayor of that city was in charge of that event, and nobody was going to take that, one of the biggest acts of terrorism in the world, and nobody took that away. And that's the way things are going to happen, locally with support.
Talk about response capabilities here regarding terrorism liaison program, community emergency response teams, all these things. What are we seeing right now? Give them a grade.
I give them a grade of
yes.
A. These have been graded by the Department of Homeland Security in 2009 as innovative best practices, things to be replicated throughout the United States, and that's what's happening here in the Valley. So we have one of the best response systems in the country.
We have one of the best response systems in the country. Do we have enough equipment? Do we have enough training? And again, we're kind of easing back to this federal funding situation.
Yeah, and so we're in a really interesting situation right now because this happened, 9/11 was a while back, so things change. Equipment wears out. People go out of the system. So we need to maintain and sustain current capabilities and capacities. And so we have to keep going. We have to keep doing this. If we don't, bad things will happen and we won't be prepared because we won't have trained people and current equipment.
Right, and one of the programs that's suffering right now is the Metropolitan Medical Response System, which is set up to handle mass casualty incidents in the country, and Phoenix is one of those MMRS units. Mesa also has one. What we're finding, because MMRS, that funding was zeroed out in the budget last year, so we're having difficulty replacing our medications like these antidote kits that I brought with me. These antidote kits we carried on nearly every truck in Mesa. We're now down 30% because most of them are out of date and we're having to consolidate.
As far as other equipment, I think we had an example here earlier today. We brought in this, what looks like what is a bomb detonation suit? What are we looking at here?
It's an explosive ordnance disposal suit
that
we purchased. You can see it on your screen. That's Mesa Police Department's bomb suit. These bomb suits are no doubt expensive, but the EOD team is really an example of that regional cooperation we have across jurisdictional boundaries. We only have 5 EOD teams: Phoenix, Tempe, Glendale, Mesa. I think the Sheriff's Office have one, and Department of Public Safety has one throughout the state. But not every department can afford that. Not every department can afford to have a hazardous materials team. These are teams that respond throughout the valley, throughout the state, wherever the emergency is.
What is the Urban Area Security Initiative grant?
That is me.
That's you, huh? Oh, congratulations.
Thank you. I am the coordinator for that. An Urban Area Security Initiative is major metropolitan areas across the United States. Originally it was about 64. That recently got cut to about 31, 32. And those 30 now are the major areas where the possibility and the risk and threat and consequence from national level acts of terrorism would exist. So those are specific within jurisdiction. Regionally here, City of Phoenix area, Maricopa County, Phoenix Urban Area Security Initiative.
How much money does this account for, and how much is spent?
We get about 11 million, I would say, and we spend it all.
Yeah.
And we use it. Now, that's a regional asset, don't forget. So we all sit together as a region, everybody in Maricopa County, and how do we make this work?
And it goes not just for the equipment. This is great stuff to look at, but it goes for some tremendous training, too. The bomb techs have to be trained. The hazardous materials specialists have to be trained. And we've also been trained to spot potential terrorist incidents. And while we can't go into any detail on, though, I can tell you that firefighters have been involved in spotting activities that might have resulted in a significant event.
You mentioned equipment. What's this cylinder thing you got here? What's this all about?
This is an interesting device. This is a radiological meter. So we will use this to sweep for weapons of mass destructions that have to do with nuclear devices. It's a very sensitive meter. We've used this at the Super Bowl. We can use this at the golf tournaments, all the kinds of big events that might be targets here in the Valley. We'll use it again on the Super Bowl coming up. It is so sensitive, we were able to detect somebody in an audience from a distance away who had just had a radiological medical procedure done the day before. So that's how sensitive this equipment is.
Okay, I think we're going to finally get a shot of this thing. It's a big dare.
Yeah.
There we go. It's like
there it is.
Like
so I'm pointing
to
the
thermos mug or something. And that's pretty sensitive equipment, isn't it?
It's extremely sensitive equipment, and we train our folks to use it. They're experts at it.
So with this in mind, and I hate to keep coming back to money, but it really is a major factor here. We got the sequester going on as well. Impact of the sequester on future funding.
Well, again, the grant programs are in flux. We're not really sure. The president says it should look this way. Congress says it should look this way. The sequesters, the other piece of this kind of comes in. So we really don't know what it looks like. So we move forward with our plans and our processes, and then we wait to see what's going to happen. I think, just to sum up, what does the future look like? I'm going to say one word: Boston.
Yeah.
Because that changes everything. Boston is, you saw the Congress and some of Congress saying, hey, we need to eliminate these response systems, MMRS, and we don't need all that stuff. Those are toys. We don't need it. And what happened in Boston? They needed it.
And I would use one word. It would be, well, two words: Tyler, Texas. Nobody's ever heard of Tyler, Texas, and that's because the FBI, working in a fusion center with local police, stopped a terrorist attack that was going to use weapons of mass destruction.
And yet, we will hear critics saying that the funding for Homeland Security in general, rife with waste, just all sorts of abuse, these sorts of things. How do you respond to that? Because we've heard everything from money's being used by snow cone machines and a submarine underwater thing for Columbus, Ohio, which doesn't need an underwater. How do you respond to that?
I have to say that we spend our money correctly here in the region. We do have several best practices. We regionalize. We across the U.S. we're known for that, and we have an effective response system, and it's due to these dollars. I have to say we know the Secretary of Homeland Security very well, and she knows us very well. Our fusion center was started by her. She understands it, and it's the national model. That's the way things should be, and we don't have any snow cone machines.
Yeah, that's good to hear. You might be able to use some here. But the idea that this money maybe needs to be tightened a little bit or better monitored, these sorts of things, how do you respond?
Well, we want to make sure that we spend our money wisely. And again, the Phoenix region has been held up as an innovative best practice. So when you look at the types of devices we have, the types of training we do, we are truly the model nationally, and particularly with our training and the interoperable nature by which our police, our fire, state, local, federal jurisdictions all operate.
Ever evolving?
Ever evolving, ever changing, just like the hazards are.
Same thing?
ever evolving, and we are good stewards of taxpayer dollars. I have to say that. That's what this is about. This is about taking those funds and using them correctly for the community, and that's what we do.
Gentlemen, it's good to have you both here.
Pleasure
Thanks
to
for
be here.
joining us. We
Thank
appreciate
you.
it. Tomorrow on Arizona Horizon, a new report compares how plans for Medicaid expansion stack up against ideas to keep the current enrollment freeze intact. And Maricopa County launches another phase of its sustainability program. That's Tuesday evening, 5:30 and 10, right here on Arizona Horizon. That is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.
Arizona Horizon is made possible by contributions from the Friends of Eight, members of your Arizona PBS station. Thank you.